Hi, everyone. Welcome to Get Well with Dr. Shell. I am Dr. Shalene Alalji, better known as Dr. Shell, and I know as a board certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshell.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Today, I have the pleasure of interviewing one of my favorite experts on men's health, Dr. Gio Espinoza. He's the first naturopathic physician to complete an internship, a residency, and a fellowship in urology at a conventional medical institution, Columbia University in New York. What a great place to do this. Yeah, love it. Dr. Gio is a naturopathic functional medicine doctor recognized as an authority in urology and men's health. He's a faculty and holistic clinician in urology at New York University Langone Health and faculty for the Institute of Functional Medicine. As an avid researcher and writer, Dr. Gio has authored numerous scientific papers and books, including co-editing the Integrative Sexual Health book and author of the best-selling prostate cancer book, Thrive, Don't Only Survive. He's also the co-founder and chief medical officer and formulator of advanced nutraceutical formulas at XY Wellness, LLC. He also lectures internationally on the application of science-based holistic treatments for urological conditions. And most importantly, he's a very dear friend of mine and so such a wonderful person to have in our lives. So welcome, Dr. Gio.
Hey, Dr. Shell, thank you so much for having me. I'm so excited to be here with you.
Yeah, so good to have you. I want to kind of talk a little bit about how we met and, how closely we've worked together with our expertise in nutritional health with some of the companies we've worked with together in nutritional
Yeah.
health and Mindshare Summit and, just really enjoyed getting to know each other and because we have this this approach, which is very similar what I do with a lot of women. You have that expertise in men and then of course we also love having fun. So I know there's a great story that you want to share about one of the times that we had a blast. You want to talk about that for a second?
So as you mentioned, we like to work hard and play hard, and certainly in the event that we met, there was a party, and of course, we both have kids. Some of them are teenagers, some are a little bit older, and we want to be a little hip. So they put on the song, right? That you taught me how to dance. This is, I don't know, 5 or 6 years ago.
My favorite group dance song. It's like
right.
I can't sit when this song is playing.
Right. So it's the wobble song, right? The wobble song with the wobble dance.
Yep.
That's it right there. That's right.
That's it. Yeah. And you had an amazing time doing this.
I was like, wait a minute, I need to learn. Wait, what are you doing? Wait, time out. I need to. I learned how to do this thing. And Joanna was like, I think Joanna was there, my wife, and she was like, God, you learned that so quickly. Fast forward to last February where we had our daughter's Sweet 16 quinceañera event. And part of the skid when I brought the girls in and we had the father-daughter dance was to dance the wobble dance. And so it was fun. It was incredible. I mean, it was pandemonium at the event. Everybody had a great time. And I had to give credit to you for showing me how to dance, how to do the wobble dance.
That's hysterical. Well, that just goes to show that we can have, we can work really hard and we can have fun and we can be hip at our age too, huh? Right?
100%. Absolutely.
So let's jump right in, Dr. Gio, and talk about your personal commitment to men's health, which is just fantastic. And how you ended up taking the path to naturopathic physician. Tell us your story. You've got a great story to share.
Well, it's a little bit of the path less traveled. So I don't know, way back I was in school. I said, oh, I want to be a doctor. I want to be a medical doctor. And then, I had issues with how medicine is done. Now, today I work with medical doctors and I'm an integrative doctor. I think that there's some value, at least as it relates to urological conditions. There are many times where I'm telling the man, look, you need, I don't know, tamsulosin or something for urinary problems or something like that for prostate. But oftentimes, certainly back then, I grew to love natural medicine, lifestyle, the power of nutrition, the power of food as medicine, the power of botanicals and herbs.
Yeah.
So I just grew to love that to the extent that I was like, there's no way I can go to just a regular conventional medical school because I'm going to be frustrated with learning the things that I don't know that I would want to utilize for patients. So I went to naturopathic school, then I went to a functional medicine, and I took even more of the road less traveled when I got into urology and men's health. It's sort of, people say, how did you get into it? I said, well, it found me. I don't know, it called me. And it just so happens that I was willing to listen is really what happened, because you know how it is. Sometimes you get caught up in life and you're not paying attention to the signals that are sent to you from whoever, the universe, God, whoever. And so I just decided to listen and it turns out, and so a lot of my colleagues, we're talking about 20 years ago now, was saying, wait a minute, men's health doctor, do you want to go broke? Men don't go see doctors. I mean, that's the worst thing you could do.
Yeah.
Well, the opposite has actually happened, where I have this little, one can say niche that is important. Men have, now as I get older and I'm a middle-aged man and I'm seeing all these men, I realize, wait a minute, we have a lot of issues.
Right.
So part of the curiosity is to kind of learn, really learn about myself and learn about my own biochemistry and physiology. And then it's intense curiosity as it relates with the prostate and hormones that are mostly associated with men, like testosterone. And how do we make that better? How do we optimize these things?
Sure.
And so I just became fascinated with it, researching it, and really, I mean, even quite honestly, sounds weird, digital rectal prostate exams, I love them too. You get to learn so much. You get to learn so much of what are you trying to look at for when you're palpating a prostate. So, it's one of those things that people say, what you really like to do? Well, liking it is an exaggeration.
Sure.
Liking it is an exaggeration, but feeling the prostate, making sure it's really a skill and art within itself. So I just became in love with the whole thing, and here we are now.
Good. So, just to kind of reemphasize, you use it as an important tool to see what's going on in the man's body, to look at it comprehensively and holistically, right? So that becomes a big part of your toolbox, rather than, just looking at some numbers on a piece of paper. You're looking at men as a complete being. And to your point, historically, you're right. A lot of men did not want to go to the doctor as much. Women go to the doctor more. The woman in the family is sort of in charge of the family's medical care, et cetera. But things are truly changing. I mean, I see that in my practice as well. When I see my male patients, they're incredibly compliant and motivated and, really wanting to do everything they can to feel their absolute best. Because a lot of us, both of us, right, we see men who are going through the male version of menopause. So there's a name for it that you and I know, andropause.
Yeah.
And I like to talk about this because a lot of men don't know. Everybody knows menopause, right? I mean, you ask a kid and they know menopause, right? Oh, my mom's going through menopause. But we don't talk about andropause, and it almost is a disservice to men, because when men are going through symptoms of andropause, such as fatigue, low muscle mass, the stamina going down, motivation going down, memory going down, libido going down, that is truly something that they deserve and need help for. So let's talk about that. What should men be looking for and what kinds of tests should they be doing, their optimal ranges. I really want to dive into that for our male audience, as well as the females who are saying, God only knows what's going on with my partner or my husband because he's not the same. So what is happening?
Sure.
Yeah.
So it's interesting, 50-50 in my practice. So 50% of the men are self-motivated. They come to themselves. They don't come with anyone else. The other 50% are drawn in by their significant others. They're typically a female.
Yeah.
And they're like, hey, you got to see Dr. Gio. This is, you know, so on and so forth. So there's a lot of components here. Number one is yeah. So andropause, you know, technically even more medically technically hypogonadism. Yes. Menopause is another kind of fun name for it, I guess, which although it's not, there's nothing fun about it.
Yes.
What happens is when I always tell women, if a man, so here's what I feel about hormones. So I'm sorry that I'm bouncing all over the place, but it's such a great topic that I get so excited about.
Yeah.
Whoever the guy is before the change in hormones, he becomes more of that when there's a change of hormones. Mm-hmm. So if he's already an aggressive type, he's going to be even more aggressive afterwards. So you would think, well, high testosterone, that is more. No, actually the opposite is true. They're more irritable. Yeah. So if they see if a woman sees, or the man just recognizes himself that he is just more irritable, mm-hmm. more easily irritated than usual, mm-hmm. then, you know, that's one of the telltale signs.
Yeah.
Yeah, typically there's less libido and less sexual desire. There is some erectile dysfunction, though sometimes men have low testosterone and still have erections. So one is not so connected to the other, but it's somewhat connected to the other. So it's not so linear in terms of testosterone and erectile abilities. But then sometimes what happens is they're having intercourse as an example, but their penis becomes flaccid before an orgasm. That could be one of the signs. Sometimes it's delayed ejaculation. That could be another sign. Sometimes it could be many, many things. Sure. Or oftentimes it's getting up at night. People think that high testosterone equates to bad prostate health. This is not true. In fact, low testosterone, high estrogen, or at least a ratio where the testosterone and estrogen level is imbalanced, that causes urinary problems in men and even BPH and enlarged prostate and all these things. So yeah, you know, there are a bunch of signs out there. I would say this, a lot of it, quite honestly, if not all of it, is lifestyle related. Yeah. So I find that men that either continue with a good, proper lifestyle, and we could dive into the weeds if you want in terms of what that really is, but sure. A good lifestyle, good exercise, decent sleep, and all these things, you know, low carb diet, all these things, that you don't have to, unlike women, which seems like it's automatic that they will reach menopause at some point, you don't have to necessarily undergo andropause necessarily as a man gets older. That is also not so linear. But it does happen because of many lifestyle related reasons and stresses and things like that. Sure. And it could be reversed oftentimes with doing some of these right things and some botanicals and things.
Correct. Well, I think.
Or,
go ahead.
Or you can, you know, use exogenous testosterone, which is also a viable approach where now you're getting prescriptive testosterone of whatever kind, T-cypionate, getting injections. There's all kinds of ways of doing it. There's either topicals for under the arms that exist. There's a variety of ways. I'll let you ask questions in terms of how deep you want us to get. But the bottom line is this: the takeaway message for your audience is the following. Number one, irritability is one of the main things you want to look for. It's not always erectile dysfunction because that can happen for many reasons, or it may not happen and they have low testosterone. Right. So, but irritability is one of the main things that one should look out for. The other is that it's lifestyle related oftentimes, and it could be oftentimes reversed with certain lifestyles and even botanicals. Or one may, if they're down and out, meaning there's no way they're going to exercise and do deadlifts like I'm asking them to do. There's no way they're going to do anything that you're asking them to do. Then exogenous testosterone is a game changer, quite honestly. It is a lot more reward and very little risk.
Yes. Well, I'm glad that you gave sort of a comprehensive answer to this, because I think it's important for our viewers and listeners to understand that this can be and is a natural process. And like you said, it doesn't have to happen to everybody, like menopause does happen to everybody, because at some point your ovarian function, declines to the point where you're really not making much of any estrogen, progesterone, things of that nature. With men, it doesn't have to happen, but when it does, the signs and symptoms are pretty evident. The message that I also want to kind of get out there to our listeners is that it is really important to not just live with it, right? It's really important to say, there are things I can do about this. One of the biggest things that I know you talk about and I talk about with my male patients is make sure you're sleeping enough. And that falls into the lifestyle area. Make sure that you're managing your stress. Make sure that you are, considering things like meditation and yoga and deep breathing and mindfulness.
And staying away from politics.
Yes, that too.
That is definitely, I'm telling you right now, that's definitely causing a lot of insomnia with my patients.
Yes, absolutely.
And I know it's not just my patients in New York.
Yep, people are getting pretty riled up right now. So, I think it's really important to really know that there are things we can do about it, and whether it's botanicals, lifestyle, and in some cases, people need testosterone replacement. And I'm glad you touched upon it because, just to let the audience know, it comes in many different forms. You've got topical, you've got injections, you've got pellet therapy, you've got sublingual. So there's a lot of safe and effective ways of doing testosterone replacement therapy. Do you want to comment on that?
Well, 100%. So just to kind of revise some of the things that I said, my typical approach with a guy that I think has low T, first of all, you test, and then the test will tell you that they have low T or not.
Sure.
And also if they're symptomatic. Let me say one other thing, and then I'll talk about exogenous medical therapies for it. The question always comes up: should you treat low testosterone if they're asymptomatic, meaning they're not complaining about fatigue, they're not complaining about sexual libido, they're not complaining about anything, but the numbers are either low or very low? What's the range? The range depends on what lab you look at, is either between 300 and 1,000. Yes. And sometimes the numbers are like, for total anyways, like 350. Right. So it's like 350. There's a wide range, and it's between it's so one can be 350 and it be considered normal. The bottom line is this: you can have, so it's very important though. So it's very important that the question arises often when I'm giving a lecture is, we're taught to not treat testosterone unless they are also coming with symptoms, right? So it's not only, so if they're symptomatic and low T, then you treat. If they're low T and no symptoms, you don't treat. I disagree. There are not only quality of life reasons why you want to do that. You want to have normal or optimal testosterone levels. There's also life-threatening aspects to it. Cardiovascular disease, prostate cancer, which for a while we thought that more testosterone is kind of fuel for prostate cancer. And what the studies show is the exact opposite, that the fact that most men with low testosterone are at a higher risk for advanced prostate cancer. So the opposite is actually true. So even from a prostate health perspective, and even to lower the risk of prostate cancer, even you want to have optimal levels of testosterone, not only for quality of life, and of course quality of life is very important as well.
Correct. Well, I'm really glad that you made that point, because a lot of men that you and I both see when they come in, they have, whether they're symptomatic or not, or they have different symptoms, they'll say, yeah, but my testosterone's been checked and my physician says it's within normal limits, and it could be at the very low end of normal, like you said, 320, 350, whatever, and the range is all the way until about 1,000. And they're just, they feel like there's something wrong with their heads because they've been told that their testosterone is fine. So describe to our audience what is within normal limits versus optimal range of testosterone.
Right. So normal limits is anywhere, if you look at the labs, is anywhere between 300 and 800 or 300 and 1,000 or whatever.
Yep.
Optimal is roughly between 600 and 800.
That's right.
That's my sweet spot. I love that. And I'm talking about, seeing hundreds and hundreds of patients.
Sure.
A whole lot more higher than that starts causing problems.
Yeah.
I don't know that it's health problems, but sometimes the conversion. So for your listening audience, and to keep the science simple, testosterone can do many things. It either can attach to its own receptors and do its own manly things. Let's just keep it simple. Or it can convert to different things. It can convert to dihydrotestosterone, or it can convert to estrogen.
Yep.
So sometimes there's a lot of conversion to estrogen, let's say. So now there's way too much estrogen relative to testosterone. Right. That's an aromatase issue, and we won't get too much into the weeds there. But or it can convert to 5-alpha reductase, another enzyme, can convert too much of it to DHT, and that could cause hair loss.
Yes.
Now, I guarantee you, correct, hair loss. I guarantee you, I know how people think. I would think the same thing. Dr. Gio, your DHT must be so high because you have no hair. It very well might be. I can tell you that my DHT relative to my testosterone is very normal and very optimal. Thank you very much. Thank you very much. It was by choice.
Yes.
It was by choice initially.
Yeah.
Now, not so much. Now, not so much.
And I'm
so
go ahead.
Sorry about that. I just want to conclude that. So it really, what happens to testosterone does make a difference, and does make a difference to even prostate health. But overall, so when guys have, I don't know, I have guys that have very high testosterone because they're either doing it for bodybuilding reasons or whatever, 1,500, 2,000 even, professional bodybuilders, their testosterone, like the guys you see on shows, their testosterone is like 3,000.
Yeah.
That is way too high.
Yes.
For many reasons. It could cause infertility. It could cause all kinds of issues. Cardiovascular risk when the testosterone is even that high. But
right.
the sweet spot for me, and of course is age related, blah, 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 blah. The sweet spot is roughly between 600 and 800 for me.
Correct. I agree. That's where I like to kind of get my male patients as well. And that's when they feel really awesome. They feel optimal.
Yeah.
And just like you said, you don't want that conversion to estrogen, or DHT. Estrogen conversion, sometimes, men will complain of gynecomastia, where they're sort of getting man boobs, and also irritability and, mood swings and things of that nature. So I'm glad that you made that point. And I just want to kind of, summarize that by saying too much is not good. Too little is not good. You got to just be in that sweet spot. So, just please remember, more is not better, right? You have to.
More is not better, and more can be a distraction, quite honestly.
Yes. But having said that, I think it's also important to re-emphasize what you and I spoke about earlier, is the misconception that testosterone can lead to prostate cancer or heart disease, when we know just the opposite is true. So I just want to kind of make sure that, the listeners remember that point as well, because your approach to urology is rather different from the standard medical care approach, right?
Yeah.
Because you focus on preventive measures that men should be taking to actually promote prostate health all through their lives. So tell us a little bit about how that differs. What is your approach?
Shel, I mean, you just like I never have a prostate come into my office by itself, right? There's always a prostate in a man's body that comes to my office. Yeah. So it's always, Robert Jones or whoever. It's not just, and that's so important. That's so important. I can tell you that the amount of frustration with patients that you've seen as well, because everything is so segmented, right? As opposed to seeing, how does one thing relate to the other?
Mm-hmm. Mm-hmm.
How does, how is the cardiovascular system related to the hormonal system to the urological system, the
Right.
GI system as it relates to the urological system. It's all connected. It's all connected. The approach is looking at it very holistically. Look, I'm not going to give a guy testosterone if, you know, their stress is 9 out of 10. They sleep 2 hours a night and having sleep issues, and their diet is crappy.
Right.
They're not going to get, you know, exogenous testosterone. They need to do things to improve and attempt to, for their own body to be able to improve the production of testosterone. And
Right.
if at some point they're doing their due diligence and we get stuck, then exogenous testosterone is the right way to go. But I tell you that between exercise, and not only exercise, because that's the thing, it has to be very prescriptive, right? It's weight resistant exercise, particularly utilizing big muscles like thighs and back. So you have to push and pull weights and primarily use those bigger muscles. That's how you increase testosterone from an exercise perspective.
Yep.
You want to be able to sleep, you know, and get deep sleep and REM sleep. You know, I drank the Kool-Aid, and I also have my Oura ring. I have my Oura ring, O-U-R-A, right? This measures my sleep. I want to know how well I sleep, and I want to know when I'm sleeping crappy, not what I think. Because here's what happens with patients. Yeah, I only slept 5 hours. I'm good with 4 hours of sleep. I only need 3 hours of sleep, and I'm good. Are you really?
Yeah.
Are you really? You're good for whatever reasons, adrenaline, or you're high, you know, you're wired, or you drink 10 cups of coffee,
Right.
but you need more. And so these type of things kind of, these sort of devices and wearables kind of objectively helps you realize, oh yeah, you're fine. You think you're fine, but you know, you get a score and the score is low. So that helps a lot too.
Yep. And the point to be made about sleep is, unless you're sleeping, the main time your body is going to detoxify and heal and regenerate the cells is during deep sleep. So if they're not getting adequate deep sleep, they are really not going through the 100%. Entire detoxification process. They're not healing their cells. They're not regenerating. They're not getting rid of the, you know, toxins. This is so important to anything and everything that we do in our fields of functional medicine. I mean, we want to make sure everybody's leading a healthy lifestyle, and sleep and stress reduction is at the center of that. Very, very important. So I'm glad that you mentioned that. Before we get away from testosterone and heart disease, can you please summarize, if you can, because I know you've read all these studies and so have I, but I want to hear it from you, and the audience would love to hear it from you. Just give sort of the take-home message about testosterone and heart disease. Let's clarify that one more time.
Sure. So
the misconceptions out there.
There's misconceptions, and the problem why there's misconceptions is because people are listening to, you know, titles on the internet and kind of type of titles from news media and things that grab the attention. I get very frustrated with the news media oftentimes because I don't think that's, you know, it's almost a race to whoever gets the information first, not looking at the accuracy of that information, which is most important. So the bottom line is this. The takeaway is this: low testosterone actually increases the risk of cardiovascular disease. It's not my opinion, it's a scientific fact. I see people oftentimes with advanced prostate cancer who get chemically castrated. And the number one concern with those people that get their testosterone to zero for therapeutic reasons in advanced prostate cancer is not prostate cancer as much as it is a heart attack or things that are related to metabolic syndrome. So there's a concern there that low testosterone levels increases, not decreases, the risk of a cardiovascular event.
Very good. And this is very, very clearly looked at in the scientific literature from really amazing institutions. So that is a really important point that I want our audiences to hear. Are you, in your practice and in general, Dr. Gio, are you seeing younger and younger men, even in their 20s, going through symptoms? And when you measure their testosterones, especially if you're looking at total and free testosterones, are you seeing lower testosterone levels in the younger population now? And if you are, then why are you?
I think, if I heard correctly, because it was coming in and out, the connection, am I measuring testosterone in a younger population?
Are you
Testosterone
seeing,
and what's younger? I mean,
20s and 30s. Are you seeing that, men in their 20s and 30s
yeah. So
being impacted now because of all the toxins in our environment? Yeah. Are you seeing that?
So the unfortunate truth is that I am.
Yeah.
I am.
Yeah.
A lot of these guys are coming in with erectile dysfunction in their 30s.
Yeah.
Few even in their late 20s. Erectile dysfunction. I don't know of any of my friends who had erectile dysfunction in their 20s. Maybe even the opposite was true. They were overly active and overly, what's happening is several things. Yes, there is a testosterone component. You take their testosterone, it's like 350. Yeah. 350 at 28? That doesn't make any sense.
Right.
It is an issue with, so there's a couple of problems happening. Number one is that men have way too much access and easy access to porn. So whether or not that's associated with low testosterone, I can't say with a high level of certainty from a scientific perspective, but it is definitely being connected to and associated with erectile dysfunction, right? So that's a problem. The other thing is stress and the stress factor. A lot of these young people are trying to get employed and they're having issues moving back home and just a lot of issues. So stress is a big factor, and yes, environmental toxins and xenoestrogens, right? These too much exposure to estrogenic compounds. That's why all my bottles, I look at numbers to make sure that it's a hard bottle and it's not soft, that it leaks BPA and phthalates. There you go. Right.
Yep.
Is that Wonder Woman? Is that the Wonder Woman symbol? Yeah. Oh, that's, yeah. I like that. I love that.
Pink for the Breast Cancer Awareness Month and Wonder Woman. So
I love it. Yeah. And the little ribbon there. I like that.
Oh, yeah. Yeah.
So too much exposures to xenoestrogens and things like that. So all these things are causing problems. Lack of sleep. Why? Because people are sleeping and going to sleep like this.
Right.
And doing a lot of that. And too much stimulation. Look, I love the internet. Quite honestly, I wouldn't want to go back to the time where there was no internet. I love the internet. I love easy access. One swipe and I get whatever I buy in 2 days. Come on. I mean, the convenience is insane. Yeah. But we overuse and you controlling it. One of the things I talk to my daughters about, the 16 and the 15-year-old, because of course, females are, as I digress here a little bit, females are at a higher risk of depression and things like that and anxiety from the internet than even boys.
Right.
Don't let it control you. You control it. You control it. The amount of time that you're involved in things like that. Same thing with men. Yeah. Same thing with men. So that they can sleep better and so on. So.
Right. So good, good point. And just to kind of summarize that, we, whether you're, a younger male, older male, doesn't matter where you are, male, female, etc., your environment, your toxic exposure, the xenoestrogens that we're exposed to in, the plastics that we are exposed to, and all of the rest is impacting your hormone levels, whether it be your sex hormones, whether it be your adrenal hormones, your thyroid hormones, as well as just your entire ability to detoxify. So I think that's a really important point, and it's not going to just happen to men or women as they age. It is happening younger and younger. And, we see this in young ladies, as we talk about as well. I mean, they're having more and more hormonal imbalances in their teens and 20s than they ever have historically. So I think that's something that's really important for all of us to sort of stay in tune with. So let's switch gears a little bit and let's talk about the thing that we all fear: cancer. I know there are a lot of misconceptions about prostate cancer. Do you find that a lot of your patients arrive to you with these myths? And please talk a little bit about some of the wonderful things that you've done, including workshops for prostate cancer. Let's talk about the C word.
Oh, yeah. So, at this point, about 50% of my work is related to prostate cancer. Maybe that's because the book that I wrote or whatever. but that's what it is. And I love it, quite honestly. So prostate cancer in general, to me, and what I've noticed is it is an opportunity for a man to do better with their lifestyle.
Yep.
So it's an absolute opportunity. The fact of the matter is that men do not generally care to be healthy. And if we keep it real, that's exactly what every man would admit to. There's little interest in being healthy. Mm-hmm. The main focus is on being productive. Productive in the office, productive in bed, productive in negotiations, and so on. Athletically, whatever. Productivity is more important to men than health. Of course, it's silly, right? Because, you know, we are in the long game. We are not in the short game, right? So the healthier you are, the more you can actually be productive in all those areas that you're interested in. So that's a very important component until they get diagnosed with what's potentially a life-threatening condition like prostate cancer, which now they have an opportunity to do the right things, right? And reevaluate things in their lives and so forth. So prostate cancer, let's see, what's a good summary for prostate cancer? About 250,000 men are diagnosed in the U.S. Roughly about 30,000 succumb to it. And that ratio, it's bad, but not horrific, as you can compare to other cancers, which the ratio is more, it's kind of worse, pancreatic, lung cancer, things like that. Sure. But still, 30% do, about 30,000 men do succumb to it. I had another podcast yesterday, and I said, well, what's the one thing that you do, Dr. Gio, that these men with prostate cancer do so well?
Right.
That the one thing, I don't know what's the one thing, because I'm not doing the one thing. I said, let me ask you a question. What is the cause for prostate cancer? What causes prostate cancer? Mm-hmm. And they were like, well, I think it might be genetics. Yeah, that could be one reason. Environmental, yep, that could be another reason. Lifestyle, yeah, that too. Stress, yep. So it's multifactorial, yeah. So why would I treat something that's multifactorial with one treatment?
Correct.
That's the worst misconception that exists. There's nothing more disheartening to me when a man gets prostate cancer, he gets treated for it. Let's just say prostatectomy, he gets his prostate removed. Okay, no problem. With the idea that that's it, is gone. I don't have to ever worry about this. I'm good to go. Right. And to not know that 40 to 50% of times, men with prostate cancer relapse. 40 to 50% of the times. That's an astronomical number. The reason why that's happening is because no one is really treating the host or the terrain,
right,
or the microenvironment. Mm-hmm. No one is treating these things. And that's the area that I actually pride myself in. So I don't do one treatment. I do many things at the same time. They're exercising with moderate to high intensity, like their life depends on it, because it just may. They're eating, they're eating better. They're reorganizing how they run their life so they can actually sleep better at night. And they're taking targeted nutraceuticals and supplements that are very targeted and helpful. So they're doing everything, and they're doing a lot of it, and their overall health is amazing. The guy that gets diagnosed with prostate cancer at 60, who comes see me, they're at 70, they're in better shape at 70 than they were at 60. And those kinds of things it's just a thrill to me.
That's fantastic. And I'm glad that you mentioned that, it is a multifactorial condition, which requires a multifactorial approach. Last night I did and as you know, ALS is a big part of our life, unfortunately. And that was exactly my point in my talk and presentation with ALS or any neurodegenerative disease or any chronic condition. It has to be a multifactorial approach. You have to look at the terrain in the person, the microbiome, the toxicity, the exercise, the diet, the lifestyle, the stress, the sleep. And that applies to really any and every condition that you might be trying to A, treat, or B, prevent. So prostate cancer definitely falls within that. And I'm glad that, you as the leader in urology are doing exactly that. And that's why your patients are doing incredibly well. Are there any other treatment protocols on the horizon for prostate cancer that you can share?
Oh God, there's so many things. Here's there are many things that are out there. There's no scarcity of prostate cancer treatments that are beyond prostatectomy or radiation at this time. There's
Yeah.
something called high intensity frequency ultrasound. So
Mhm.
really, is any energy. So you get rid of cancer cells
Yeah.
by with any energy, right?
Right.
It could be ultrasound, it could be photons, any energy,
Sure.
or change in temperature. It
Yeah.
could be high heat,
Yeah.
as long as it doesn't damage other cells. It could be cold and freezing, and like as in cryotherapy. So there
Right.
are many, many treatments out there. The question becomes, what's the best treatment for that one guy in front of me that will actually best attempt to cure them
Yes.
without too many adverse events and side effects? That
Yeah.
is always the question. And
Right.
I just want to reemphasize that lifestyle medicine and natural approaches is to real, real medicine that's really important. And if you just do one thing, if you just do the prostatectomy, if you just do the radiation,
Yeah.
I think that you're shortchanging yourself. Let's
Right.
talk radiation for a second. When they radiate the pelvic area, great. Guess what happens? And this is the literature. This is not my biased opinion. This is literature. This is objective. There's secondary cancers that can occur in the bladder
Yeah.
years later. Why? Because you're radiating a healthy tissue that
Right.
now becomes damaged and cancerous within time.
Yeah.
So it's an area that I've grown to love. I've learned a lot of great women. By the way, I need to give an ode to these women.
Yeah.
You're taking care of your husband so well. Women who I tell you right now, I don't know how men do it without a good woman by their side when they are succumbing to any illness. I just don't know.
Yeah.
It's unbelievable how great women are. And I say women because I don't have a whole lot of gay patients who they probably do the same. But women, I tell you, I don't know if it's nature, they do such a job. And their husbands are significant, are so grateful. It's amazing. If I were to do a study, and I haven't, unfortunately, when I compare men that are on this journey by themselves
Right.
versus men who have a woman by their side,
Yeah.
the one with women are by their side and a significant other do so much better
Right.
as a whole. So
Yeah.
I have many women in my life, including 2 daughters and an amazing wife,
Yeah.
and I could tell you that it's just amazing what you guys do.
Oh,
So an ode to all the amazing women out there, including you, Dr. Shah.
thank you so much. Thank you. It is truly an honor and privilege to have been taking care of my husband. He's an amazing, amazing man. You've met him. He's incredible. And yes,
Absolutely.
it has been a tough, tough journey, but there is some level of intense nurturing that we have in our genetic code. But unfortunately, and I kind of want to say this to a lot of women out there that might be listening, if you are a caregiver, pay attention to yourself as well. Make sure that you're exercising self-care in addition to caring for your loved one, because when you don't do that, when you don't take care of yourself and you don't exercise the same principles that you do for your family for yourself, that's when trouble can happen. And in my own personal journey, I've experienced it myself. 1 year ago, yesterday, is when I was diagnosed with breast cancer. And that was 2 years into the journey with ALS. So, it is an important point to make, and that is do for yourself that you would do for your loved one. Treat yourself and
it's hard to say. It's hard to say whether there's a direct link or not. But in your opinion, your experience, would you say, is there a link there in your? I'm sorry that the interview is going the other way now, but just is so interesting.
Well,
Maybe I need to. Where's my podcast? The Dr. Gio podcast. I need to get Dr. Shah in here right now. What's going on here? I mean, it might be even more interesting. But do you find that there's a potential link between the stress and so on and your own diagnosis? Would you say that as best as you can tell?
I have no doubt in my mind that there is a direct link. I'm not going to say for myself because there is no way to tell, right? I do feel very strongly, and this is based on 20 plus years of me practicing medicine and seeing whether it's men, women, or what have you, when you have tough conditions come up, there is a huge link between stress, lack of sleep, lack of self-care, and just not nurturing yourself, and a lot of emotional wounds to chronic diseases. And those chronic diseases can be anything ranging from cancers of any kind, autoimmune conditions, fibromyalgia, or neurodegenerative conditions. So there is a huge link, and I truly believe that there is a link. I believe in God's greater plan. And just like we started off this discussion, you said that, your mission fell into your lap, your purpose fell into your lap. Same way, I believe that all the years of functional medicine that I have practiced and learned from, and everything that I have done in the field of medicine for the last 20 plus years prepared me to take care of my amazing husband and his ALS, as well as to take care of myself during my breast cancer journey, because I know for a fact, and I have no doubt in my mind, that my future journey is going to be quite focused on helping women with breast cancer, as well as people with ALS and other neurodegenerative diseases. So missions find themselves. I mean, you don't choose your mission.
Lovely.
Your mission chooses you. So, that would be my honest to goodness.
Lovely. Well, thank you so much. Thank you for sharing that.
Absolutely. So
thank you so much for sharing that. Actually, what you said now will actually help me kind of give a little bit of a tidbit of information to all these amazing women that are trying to help their prostate cancer patients. And I think it's going to be included in my writings as well. So Thanks for sharing that.
Absolutely. Absolutely. Before we end, I want to tell our audience, how can our listeners go to get more information? Because your information is so valuable and you're such an expert in the field. How can they get more information about you and about working with you?
drgio.com is the place. I don't know if you said that already. drgio.com. Everything is there. I try to give a lot of information as much as I can, keep people up to date with the things that I know. Functional urology and prostate issues and male optimization. That's what I know. So thank you so much.
Absolutely. It was such a pleasure having you here today. And thank you for giving us and our audience such great wisdom and your experience with men's health and prostate cancer. Thank you so much.
Thank you. Thank you for having me.
Thank you so much for making time for today's podcast with Get Well with Dr. Shell. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshell.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.